I have two scenarios in mind that I can think of that are recent. I have a patient who we saw about 6 months ago, has a partial denture, who's a older patient, and typically older patients come in now, not generalizing, but oftentimes you see they have biofilm all around, everywhere. And it's just, management, home care in older patients, seniors is oftentimes a difficult scenario. So he has a partial denture, tooth number 27, recurrent decay under that margin. So what I did was I said, this is a perfect example for Infinix. So we prepped the tooth, and then we put Infinix along that margin and then sealed it off and let him go. So then fast forward 6 months, patient comes back. And I told my hygienist, okay, before you do anything, I just want to check that restoration, see what it looks like. So it was remarkable. We take off his partial denture. He has biofilm around all his teeth, but the one area where the Infinix was on that margin, it was clean. It was almost like pushed away. It was like bizarre. And so I'm like, okay, wow, that's kind of impressive. Now I'm thinking to myself, where else can I use this? Everywhere. But it was very interesting. That was the one case. The other case happened last week. We have a patient who comes in. He has two crowns, number 2, number 3, both zirconia crowns, has irritation between the two teeth, has recurrent decay on tooth number 2. I looked at this, I said, okay, this is a scenario where I think we can do something here. I laser removed the crown number 2. Then I excavated the decay. It was sort of a deep margin elevation type of scenario. Remove that decay, put Infinix into the site, close the contact with a little composite material on the crown number 2, and then re-cemented it. Again, that's profound, because if we can save the patient from having to do a complete new restoration, that's wonderful for us to be able to do that. So those are the two big cases that I've been using it with.